So medical negligence, another name for it is medical malpractice, which occurs when a healthcare professional breaches, fails to carry out his duty of care to his patients. Are we there? Is a legal concept where it's used to determine what the medical professional is supposed to do. The standard of care. You people were taught of standard of care in your area of practice, right? Where it's used to determine if the medical professional failed in its standard of care to the patients. Are we following? The points to note especially are: one, duty of care. The healthcare professional, you owe your patients the duty to take care of your patients adequately. True or false? It's among your oaths that you took while being inducted as nurses. The second one is what? Breach of duty. Have you breached in that your duty of care? Have you failed to give your patient the prerequisite adequate treatment he or she is expected to get from the facility, or especially from you as being a healthcare professional? The third one is what? Causation. This is your breach now. What did it cause the patient? Are we there? Your failure to take care of your patient, what did it lead to this patient? Did it lead to injury, physical harm, or in worst cases, death scenario? So now, if all these your actions led to that, that means you're what? Medically what? Negligent. Are we there? Then the last one is damage. All these your actions that you took as a medical professional, it caused what? Damage to the patient. It caused harm to the patient. Examples of negligence is misdiagnosis. This can be found more of in the lab area, where who is in the lab here now? Where a patient comes and you take blood and you fail to get the issues. Your lab failed to relate exactly to what the patient is suffering from. You misdiagnosed what? The patient's illness. The second one is wrong dosage of drugs or overdosage. That is the nurses section, right? Where a patient came in with migraine, and when you gave us something the last time where you said they came and took 5 mil, they came again and took another 5 mil, right? Just within a particular section, yes. So now you gave a wrong dosage of drug to the patient, either over or under. Failure to obtain consent. We have a consent form, right? Yeah. Where any patient that wants treatment signs, I consent to this, especially in surgical operations. Then you fail to obtain that consent from the patient, either the patient relative or the patient itself. That is, if the patient is able to sign, like is fit enough to sign, he or she signs. But where he or she can't, the patient relative does that, and you fail to obtain this consent, you're deemed to be what? Medically negligent. Inadequate follow-up. We know, yes, we've finished treating, they've gone, and we fail to follow up. Are we there? We fail to do what? Follow up with what? Their routine, their drugs. Maybe there is a patient that is an outpatient, right, that comes in to take drugs. Maybe he or she has been discharged, and there are still drugs they are supposed to take or injection. And today the patient didn't come. You didn't make effort to call. You're supposed to come here for your injection. What happened? The next day you didn't see the patient. There was no effort from you as to, we discharged you, quite all right, but your drugs are still remaining. The patient never gave you a reason as per, maybe I don't have the financial capacity to follow up with the drugs. There was no reason, there was no effort from you to ensure that the patient does what? Takes care of his like follows up, takes his injections or whatever. afterwards being discharged. The next one is surgical errors. That one, I know to an extent, is been minimized, where you forget scissors in the patient's stomach and all the rest of that. To an extent, it's been minimized, but there are still surgical errors that most of us also, most of the healthcare professionals also are being found wanted in. Are we there? Next one is birth injuries. Birth, birth. You're giving birth to a baby, and in the process of your carelessness, you broke the baby's hand, or you broke the baby's legs, and it's your fault due to what? You were careless. Not that the baby was actually coming out deformed, but you, on your own accord, by yourself and with yourself, you did what? You caused the baby to be deformed. Are we following? It happens, true of us. It does, right? So now, out of your own negligent acts, or I don't care acts, you gave the baby an injury. The mom can sue you for that, because through the scan, the baby was okay. Hands okay, legs okay, everything was okay. But the baby came out and then he's having a serious deformity. Either the head is being pressed together. I don't know how you guys give birth, but I'm sure you are relating to what I'm saying. So now this negligence, they have the legal and ethical liabilities. The legal one is you can be sued for civil liability. Civil what? Liability, that is damages. Where maybe it didn't result to death. The patient can sue you for civil damages, which can be in form of monetary. Are we there? You compensate heavily for that. Then ethical. I'm sure in your ethical area, you will have where your license is being taken away from you for being grossly negligent. There's also the criminal aspect. That one now is the baba, where it causes death. Are we following? You're being sued for what? Murder. And then the ingredients of the murder will not be what? Medical negligence. If found guilty, you go in for it. So now medical negligence, it's more like your breadcrumbs of your profession. It's like the fulcrum, where whenever you're found negligent in your acts as a medical professional, you can go in for it either by civil way or by criminal way, or civil or criminal and ethical, because when you're being charged criminally, I'm sure the medical professional will take your license from you when you're being found guilty. Even if you're being found in civil and you're meant to pay compensatory damages, the ethical area, they will still take your license. True or false? So now, improving medical negligence, there's something called standard of care. Standard of care is determined through expert witness, where we call what? Expert witness. Maybe you're in court, you call an expert witness to come and give us what is actually the level of this standard of care. Are we there? What is actually the level, the benchmark that a medical professional is supposed to get to in giving his or her patients the required treatment. So now, proving this standard of care now, there are characteristics of this. Establishment through medical witnesses. That is, you call a medical doctor that will come and say what this standard of care is. Okay, let me give you a case, although it's a United States case, where a baby was taken to hospital. Are we following? I think the baby was having seizures and all the rest of that. So now, they admitted this baby in this facility, and they called on the doctor to come and look at this baby, but the doctor failed to come. I'm like, okay, fine, there's nothing I can do in these circumstances, having seizure, all those things. I can't intubate. So now in this case now, a 2-year-old boy was admitted in a hospital. He experienced 2 episodes of breathing problem. The doctor was called upon. Doctor refused to come. So now the baby, after like 30 minutes, the baby still experienced another severe episode, which led to brain damage and death. So now when the mom sued the hospital for negligence, on the ground that this doctor could have actually come out, are we there, to see this baby, at least just come out and see, and even if it's just to tell the mom some things or something, just to tell her what is wrong with the baby. So now the doctor came with his own defense that this baby, he couldn't have intubated the baby even if he came out. So there was no need for him to come out. Are we following? More like, maybe let's use nurses. You were asked, matron, you were asked to, a patient came in, you're supposed to check the vital signs. Are we there? And probably check the vein. If it's possible, take out blood, right? You guys are the one that take out blood. I busy the lab. The nurses. Okay, both. So now, and the nurses will not be like, no, let nurses go and check the vital. There's no need of me coming out. You're already an expert in the field. Are we there? You delegate your duty to your student nurses. All in the thought of you've taught them. Was this lady that we gave the duty of sanitation that said that she has taught Grace? Are we there? And then this it now results towards complications, and you come to court and tell court that you didn't see the need of you coming out to come and do the vital because you assigned your student nurses to do that. The court actually held in this particular case that he would have actually done what? Come out. That failure to attend to the patient regardless of the treatment, the appropriate treatment, failure to attend to the patient regardless of the fact that you're not supposed to intubate the baby. We already know that fact, that you're not supposed to do what? Intubate the baby. But your failure to come out has actually held you what? Culpable. Are we there? So now it was determined in that case that timely assessment, timely what? Assessment, intervention, not just the appropriate treatment needed, can hold you what? Culpable to medical negligence. So medical negligence is a whole lot. We should just be very careful not to be seen doing or aiding or abating. Abating means helping. Are we there? To be found wanted of what? Medical negligence. So please try and be more careful next time.